Gestational diabetes. On the occasion of World Diabetes Day, we have two amazing speakers lined up to speak about gestational diabetes do's and don'ts. Well, to begin with, I would like to introduce myself, your host, Dr. Pooja, and with me joining today is Dr. Nitu Singh and Dr. Prachi. Thank the panelists to taking lovely time out from their busy schedule and joining us for this live session. BabyChakra has always been doing these live sessions with the panelists who have been sharing their wonderful thoughts and also reach to all our moms at the community. Without further ado, I would like Dr. Neetu to please introduce herself for today.
Yeah. Hello, all lovely mothers and listeners. I am Dr. Nitu, Obstetrician and Gynecologist. I practice in Daisar, Mumbai, and think briefly about gestational diabetes mellitus. Will brief you. Will let you know what is the treatment, the precautions, as well as the later on repercussions. So I welcome you. Thank you.
Thank you, Dr. Neetu. Dr. Prachi, can you please introduce yourself?
Hi, I'm Dr. Prachi Dua. I'm a homeopath practicing in Delhi. My clinic is in Vasant Vihar, Delhi. So I see patients there and I also give online consultations where medicines are couriered to people's location. And I'm really looking forward to this session. Hopefully, it will be enriching for all our viewers.
Yes, definitely. Thank you, Dr. Neetu and Dr. Prachi. Well, we all know that gestational diabetes is a part in which your sugar fluctuations can happen and it may hamper your pregnancy. But to unfold these events, we have a few set of questions which these doctors would be answering. So, to begin with, I would like to ask Dr. Neetu, what is gestational diabetes and what, with the help of this definition, can you help us to understand the few do's and don'ts about this, please?
Gestational diabetes means it has to do with carbohydrates. So basically, it's a state in which the carbohydrate intolerance develops. It may be of varying severity. The body is not able to manage glucose, which routinely our body used to manage before we. So therefore, it is called gestational diabetes. Gestational diabetes is actually a separate diabetes, which in general public जानती है. That diabetes is different. Develops only during pregnancy, and the diagnosis is different. The treatment protocol is completely different. GDM is very important. We call it GDM short form. Why diagnosing is very important? Repercussions on the health of both the mother as well as the baby. So therefore, screen patients at very first visit when they visit us in the OPD when they are first pregnant. That's the best time to screen these patients for diabetes in pregnancy. And don't see, first we have to diagnose whether a patient is having diabetes or not, because कई बारी patients आते हैं जो already diabetic होते हैं, but because they have never approached a physician, उन्हें पता ही नहीं चलता and they conceive with diabetes. So these are the patients जिसको हम ये pre-gestational diabetes है. और diabetes in pregnancy वो है जो हमारे पास and pregnancy के समय पिकअप होता है कि okay, now they are diabetic. Diabetes diagnosis in pregnancy via blood sugar levels, which can be in various forms like fasting sugar, post-lunch sugar, and guidelines. Nowadays, we do the glucose challenge test, which is who are not diabetic but may develop diabetes around 28 to 32 weeks of pregnancy month, which is a peak time जब हमारा glucose intolerance highest level पे रहता है, and these kind of patients and treat them accordingly.
Right.
And coming to see, basically it's a very wide answer वाला question. यदि एक बार पता है कि diabetes है, then the don'ts come in. I think gradually as we go ahead in the session, we'll come.
Right. Very, very insightful thoughts that you have shared with us. Coming to Dr. Prachi, can you please help us with the symptoms that are associated with gestational diabetes?
Okay, like Dr. Nitu has already told us that there are major differences in diabetes mellitus and gestational diabetes. The symptoms somehow are very similar. Like there is increased प्यास ज़्यादा लगना, भूख ज़्यादा लगना, फटीग, थकान महसूस होना, इंक्रीज़ यूरिनेशन, बार-बार वॉशरूम की फ्रीक्वेंसी बढ़ना। तो जो सिम्पटम्स हम डायबिटीज़ में देखते हैं, उससे काफ़ी सिमिलर रहते हैं जेस्टेशनल डायबिटीज़ सिम्पटम्स। और यीस्ट इन्फेक्शन, यूरिनरी इन्फेक्शंस बार-बार होना, ये दिखाता है कि बॉडी में ग्लूकोज़ लेवल जितना होना चाहिए उससे बढ़ा हुआ है। So these symptoms can help us realize that something is wrong and we can visit a doctor and get tested.
Okay. Thank you, Dr. Prachi. Dr. Neetu, coming back to you. Does diabetes, gestational diabetes, a women's health into risk during pregnancy? What would be your thoughts on this?
It does. See, firstly, there are predisposing factors wherein a patient develops. These are the women who typically have a high body mass index. When I say body mass index, included as those individuals who are overweight prior to pregnancy. See, in pregnancy, these are the individuals who have a high risk of diabetes in the family or have a higher body weight, have predisposing high risk in previous pregnancies. जैसे कि पहले प्रेगनेंसी में यदि डायबिटीज हुआ में बेबी वेट इज ऑन द हायर साइड, लाइक हम उसे लास्ट को जेस्टेशनल एज बेबीज कहते हैं, जिनका बेबी 4 kg रहा हो, या फिर अनफॉर्चुनेटली किसी पेशेंट की पहले बेबी का, यानी कि if it is a stillbirth, or if there is a previous pregnancy who's had babies were not formed properly. So these are all predisposing factors wherein once a patient walks into from the history, conclude whether a patient is going to be prone to that or not. And in being Asians, we have a high propensity to develop diabetes in pregnancy. So as we screen all the patients for diabetes once they enter the OPD, be it in the third month of pregnancy.
Right. So, Dr. Neetu, that was a very insightful answer. And also, with these guidelines, I believe that every mom is very vigilant about her health, and then she goes to her gynec and is well informed, which is very very
Yes.
important. Right. Dr. Prachi, I would like to ask you, what are the tests that we need to conduct for a gestational diabetes? Like, can you please help us out over here?
It mainly starts with blood tests. So there are two types of blood tests. जो स्क्रीनिंग टेस्ट होता है दैट इज़ लेवल 1, दैट इज़ ग्लूकोज चैलेंज टेस्ट. तो इसमें
Okay.
पहली बार अभी तक जो डायग्नोज नहीं हुए हैं उसका पता चलता है ग्लूकोज चैलेंज टेस्ट में. तो इसमें फास्टिंग की रिक्वायरमेंट नहीं होती है. यू आर मेड टू ड्रिंक अ ग्लूकोज सिरप एंड देन 1 hour लेटर योर ग्लूकोज लेवल इज टेस्टेड आफ्टर टेकिंग योर ब्लड सैंपल. और इसके बाद जो होता है टेस्ट दैट इज़ ग्लूकोज टॉलरेंस टेस्ट. उसमें 8 hours फास्टिंग के बाद योर सैंपल इज़ टेकन एवरी 1 hour और उसमें से किसी में भी अगर ग्लूकोज लेवल बढ़ा हो तो योर स्क्रीन फर्दर. इसके अलावा एक नॉन स्ट्रेस टेस्ट होता है. अगर कुछ इसमें दिक्कत पाई जाती है आपके टेस्ट में देन यूर सेंट फॉर नॉन स्ट्रेस टेस्ट. तो वो डॉक्टर जज करते हैं इफ़ यू नीड इट. बट बेसिकली इट स्टार्ट विथ ब्लड टेस्ट जो कि
Okay.
आप रेगुलरली मॉनिटर कर सकते हो.
Right. So, so these tests are prescribed by the doctor in the 7th month, right? Right, Dr.
Yeah.
Prachi?
Yeah, no, no.
Okay.
I'll just add basically, see, it is the more OPD. She has her own history. She may be a first patient who's its first pregnancy, abortions, or some bad obstetric history, like I said, previous anomalous baby, abnormal, and all. So based upon these tests, we decide whether the patient has to immediately go, like how whether we have to subject the patient to a glucose tolerance test or just a routine single fasting sugar, postnatal sugar, and HbA1c. It all depends upon the history. But we go for the post glucose blood sugar, wherein we ask the patient to take 75 grams, and the blood sample is drawn after 2 hours, and according to the values, we come to know whether the patient whether she has impaired glucose tolerance or whether she's a frank diabetic. And based upon the
Okay.
screening, we test, and then we
Right.
label her as a diabetic.
Right. Since
Yeah.
now we have got to know about how the screening is to be done, when is to be done, and how meticulously it has to be followed, Dr. Prachi, Dr. Neetu, we have a few questions from the mom who has just asked me, like, how do we get our gestational diabetes treated? So, would you like to answer that?
Yes. See, diagnosis done means now we have to know how poorly or how well controlled is. Initially, we try to give only gestation. We ask the patients to follow a tight glucose control by following a strict diabetic diet. Nutritional therapy. If the values are too high, we may put the patients on insulin, oral hypoglycemic drugs. These are the drugs which lower the sugar levels. The main
Right.
key is very good and tight sugar control. तो इसके लिए
Okay.
it depends patient का कैसे presentation रह रहा है, tablets or diet or insulin or all.
Right. So, definitely
Here,
the mother.
Dr. Pooja, here I'd like to add about homeopathic treatment options that are also available. Other than
Sure.
what Dr. Dua
Definitely.
said, I'd like to share that homeopathic medicines are safe to ingest during pregnancy. जैसे pregnancy में काफ़ी medicines डॉक्टर नीतू contraindicated होती हैं. Like you know, homeopathic medicines are safe to consume. तो डायबिटीज़ या फिर ब्लड प्रेशर इवन ड्यूरिंग प्रेगनेंसी ऑल द प्रॉब्लम्स दैट आर सीन ऑल द सिम्टम्स दैट वी कम अक्रॉस ये सब इजीली मैनेज हो सकती है विद होम्योपैथिक मेडिसिन सो दिस इज़ वन ऑप्शन दैट शुड ऑलवेज बी केप्ट ओपन
Wow, this is a new fact that because
या
homeopathic medicines is हमेशा वो मीठी गोली खाना it's type होता है. So we since our childhood that we've been eating those, and that's a
Patients
very
are
nice.
happier with the subtle dose of those pills.
Yes,
Yeah.
दोज
yes. So it's a very nice thought that you have shared, Dr. Prachi. Well, Dr. Prachi, I'm coming to you for the next question. The mom has asked me. She is saying that can I avoid anything during the gestational diabetes in terms? So can you please help me out over here?
things that you need to avoid to develop
Yes,
gestational
during
diabetes.
yes.
Okay, so diet and exercise, both of these come
Okay,
first. Want to
okay.
prevent getting gestational diabetes, एक तो लो कैलोरी हाई फाइबर डाइट रखना
Mm-hmm.
जिसमें टेबल्स जो हेल्दी डाइट की डेफिनेशन हमें सबको पता है बट हम
Mm-hmm.
फॉलो नहीं करते के लिए वो डाइट को फॉलो करना एंड देन
Okay,
एक्सरसाइज एक्सरसाइज में हम हैवी वेट लिफ्टिंग नहीं बोल रहे हैं टू आर प्रेग्नेंट फीमेल्स वी वांट मॉडरेट एक्सरसाइज 30 minutes ऑफ वॉकिंग फॉर मोस्ट डेज ऑफ द वीक तो ये बॉडी को स्टाइल को हेल्दी रखेगा तो इट विल प्रिवेंट डेवलपिंग डायबिटीज़ और जो स्टार्ट वेट होता है प्रेगनेंसी का लाइक सम
Mm-hmm.
आर 50 kgs when they get pregnant some are 70 kgs so the start weight होता है that is also very important so before you get
Okay,
pregnant you should develop a healthy weight ज़्यादा अगर आप ओवर वेट होके करते हो तो देन यू आर मोर प्रोन टू डेवलपिंग जेस्टेशनल डायबिटीज़ ऑल्सो जो 8 to 10 kgs हम ऑब्जर्व करते हैं ओवर द
correct.
9 तो वेट गेन होता है दैट इज़ ऑल्सो डिफरेंट फॉर पीपल जिनका कॉन्स्टिट्यूशन डिफरेंट है अगर आपको ऑलरेडी
Mm-hmm.
आप ओवर वेट हो देन उतना वेट गेन नहीं है नहीं
Okay,
सजेस्टेड है तो based on your current body type and how your activity levels your lifestyle तो उस पे डिपेंडेंट होता है कि आप कितना वेट आपको गेन करना चाहिए कितना सजेस्टेड है तो उससे ज़्यादा ना करें तो इट विल बी हेल्पफुल टू अवॉइड गेटिंग जेस्टेशनल डायबिटीज़
okay. These are very insightful points that you have mentioned out over here, and definitely the mother is very thankful to the answer that you have given. Dr. Neetu, coming to you. Does the gestational diabetes affect the baby? Now this is a very common concern which I also get on BabyChakra app, and the mothers are saying कि I'm 28 week pregnant and my sugars have come this much. पहला सवाल होता है, will it affect my growth of the child? How would you like to take it up?
100%. It is a disease जिसको हम इतना स्क्रीन कर रहे हैं तो इसका इट गोज विद तभी हम इसको इतना स्ट्रिक्टली स्क्रीन कर रहे हैं और इसे ट्रीट करने की कोशिश कर रहे हैं.
Yes.
अब क्या है या पेशेंट में कब आ रहा है उसके ऊपर डिपेंड कर रहा है. If the patient develops gestational diabetes, positive for diabetes, like diabetic in the first trimester, which is the first 3 months of pregnancy, the sugar controls are not good. There are very high chances of anomalies in the baby. Anomalies, heart बराबर नहीं बनता है, renal problems, spine issues, sacral problems. So these are like to have in our own child. Therefore, the screening is very important and treatment. यही चीज़ें अगर पेशेंट डेवलप होती है तो आगे जाके certain symptoms like baby being on the high weight wise, or after the when the patient is still pregnant, the like raminos may develop, or even there are high chances कि the patient has a normal full term, पूरे normal है, अच्छे रहते हैं, but at the end she may end up with an operative delivery because of the baby being on the many times after actually main complications start cropping up post delivery के होते हैं baby को, calcium and this electrolyte maintenance, the panorama of symptoms which the baby may develop, which obviously is going to be picked up by the pediatrician as well as the gynae. So therefore treatment and control is very important, because depending patient has developed and whether she's taking treatment or not, there is going to be repercussions.
Thank you for this input that you have shared with us. So it is a mandate that you have a check with your doctor when you are nearing your 7th month for checking onto your sugar levels. Yes. Dr. Prachi, coming to you. This is a question which a mother would like to ask. Does gestational diabetes happen before or after pregnancy? What would be your thoughts on this?
Gestational diabetes, like the name suggests, gestation, it is first diagnosed during pregnancy. तो ये इसके सिम्टम्स और जो ये डेवलप होता है ये प्रेगनेंसी के टाइम पे ही डेवलप होता है. आफ्टर प्रेगनेंसी क्या होता है, 6 to 12 weeks आफ्टर पोस्टपार्टम, आफ्टर यू डिलीवर्ड योर बेबी, उसके बाद भी योर ग्लूकोज लेवल्स आर चेक्ड रेगुलरली. तो इफ इट कम्स बैक टू नॉर्मल तब ठीक है. इफ इट डजंट देन योर प्री डायबिटिक और योर स्क्रीन फॉर डायबिटीज़ फर्दर, और उसके अकॉर्डिंगली उसका ट्रीटमेंट स्टार्ट होना ज़रूरी होता है. तो डायग्नोज ये फर्स्ट आता तो ड्यूरिंग डायबिटीज प्रेगनेंसी है, बट उसके बाद भी यू हैव टू रेगुलरली गेट योरसेल्फ टेस्टेड, योर लेवल्स स्क्रीन्ड, ग्लूकोज लेवल्स
Screened, definitely. And the mothers need to be vigilant about their health, and if they are planning for a second pregnancy, and if they've had GDM in the first case, then definitely they need to take these measures, speak with their doctors, and definitely take the valuable steps, which is definitely helpful for their own health. So with this we come to the end of. Yes.
I would adding that if it is a second pregnancy, some things that can help you know if you will be more prone to developing GDM. अगर आपका first child का weight, if the first baby was overweight, if it was a macrosomia, then you're more prone to getting diabetes again, gestational diabetes. और अगर आपका, like I mentioned, body weight, if you had PCOD in the pre-pregnancy time, और अगर आपको ऑलरेडी डायबिटीज़ है, तो ये सब फैक्टर्स दे कैन हेल्प यू नो आप कितना प्रोन हो टू गेट जेस्टेशनल डायबिटीज़, और उसके अकॉर्डिंग यू कैन बी मोर vigilant about screening yourself.
Yes, definitely, Dr. Prachi. With this, we come to the end of the question answer round. But we would ask the doctors to give away a takeaway message for our users. So, Dr. Nitu, would you like to sum up with a takeaway message, please?
To sum up, in short, gestational diabetes is an alarming condition, but yes, there is treatment, and it's the pregnancy as well as the neonate, that is a newborn baby, to go future. So basically, timely contacting the gynecologist and following the is to be done. As Dr. Prachi has already said about the body, maintaining a lower body mass index, keeping your weight on the lower side, because see, nowadays we don't just people plan pregnancies. So once you're planning before that, if you know you're prone to diet, if you're already a PCOD patient, try to maintain your body weight on the lesser side, chances of developing GDM in the further pregnancies. And obviously, as I stressed upon, if we have, we will make sure that our sugars are well controlled before we conceive. That's the key to later on.
Right. Dr. Prachi, would you like to give away a takeaway message for our audience, please?
Yeah, the takeaway message is that everybody asks you to take care of the baby that is there in your uterus, but you should also take care of yourself during pregnancy. It is a very crucial time for the body. It is undergoing several changes. Monitoring
Right.
your glucose, like we've talked about GDM, is one of those things. It starts there and it goes up to post pregnancy, postpartum blues. So
Mm-hmm.
everybody take care of the baby. There are several people who will give you several advices to do that, but you should be vigilant about your health and take care of yourself. And good luck for that.
Thank you, Dr. Prachi. So, to sum it up, we can say homeopathy does work in favor of GDM, exercise, good diet control, and always being vigilant and talking to your doctor in case you have a doubt about your health and your safety. This is all what we bring to you for understanding today's topic, managing gestational diabetes, do's and don'ts. And with this, we would like to thank our panelists for their wonderful information. We at BabyChakra are always bringing up with different topics relating to parenthood and motherhood. Stay tuned to join us for some more live sessions coming up ahead. And if you want to get connected with these doctors are available on the Baby Chakra app. They will guide you throughout your pregnancy to have give you a valuable support. Download the app today, and definitely you can reach out to these doctors. Thank you again, doctors, for joining us for this such a beautiful session.
Yeah. Thank you, Dr. Pooja. Thank you, Dr. Prachi. Thank you. Good day.
Thank you. It was lovely.
Thank
Thank you,
you.
Baby Chakra.